Hello and welcome to the Oaktree Connect podcast, where we have real conversations about mental health, emotional well-being, and the paths that help people heal and grow. I'm Emma, and today we're talking about something that's helping many people live calmer, more balanced lives: cognitive behavioral therapy, also known as CBT, and integrative psychotherapy. To help us understand these therapies and how they work in real life, I'm joined with Bilquees Kamal, one of our experienced therapists here at Oaktree Connect. Welcome, Bilquees. It's lovely to have you with us.
Thank you, Emma. It's great to be here, and I'm really happy to talk about this topic. It's something very close to my heart.
Let's start with something many listeners might have heard of: CBT. But not everyone really knows what it is. Can you explain it simply for us?
Of course, CBT, or cognitive behavioral therapy, is a practical and structured form of therapy that focuses on the link between our thoughts, emotions, and behaviours. When we're struggling, maybe with anxiety or low mood, our mind can fall into patterns of negative thinking. For example, I'm not good enough, or things will never get better. These thoughts influence how we feel and what we do. In CBT, we work together to spot those thoughts, question them, and replace them with more realistic and balanced ones. We also look at behaviour, because sometimes what we do can keep the problem going, like avoiding situations that make us anxious and becoming stuck in a rut. So CBT is about learning new ways of thinking and acting that help break those cycles.
So it's like becoming aware of what's really happening inside your mind and gently retraining it.
Exactly. It's empowering because it gives people tools that they can use long after therapy has ended.
Now, you also practice something called integrative psychotherapy. What does that even mean?
Integrative psychotherapy is a flexible approach that combines different types of therapies like CBT, person-centered, and psychodynamic techniques, depending on what the individual needs. It recognizes that no single method fits everyone. So while CBT focuses on present thoughts and behaviors, integrative therapy might also explore past experiences, relationships, and emotional patterns that shape how we respond today. It's about understanding a whole person, their story, their emotions, their coping styles, and using whatever methods best support their healing.
That sounds very personalized, like therapy that grows with the person.
That's exactly it, Emma. Every person's journey is unique, and the therapy should reflect that.
Of course, yes. So, when you're working with someone, how do you decide what to use, CBT or more integrative approaches?
Hmm. Usually, we start with what the person needs most at that moment. If someone feels really anxious or stuck in negative thoughts, CBT can be a great starting point because it's practical and it gives quick relief. But as they start feeling more stable, we might go deeper, looking at where those patterns came from, exploring relationships or early experiences. It's a bit like building a house. CBT gives you the tools to fix what's urgent, and integrative therapy helps you to understand the foundations.
Wow, that is a wonderful way to put it. First, stabilize, then understand. Can you paint a picture of what therapy might look like for someone starting out with you?
Yes, sure. In the first few sessions, we get to know the person, their challenges, goals, and their life story. I also explain how therapy works, so they feel comfortable and involved. Together, we might track thoughts and emotions, identify unhelpful thinking patterns, and plan small actions to build up confidence. Over time, we go deeper, exploring feelings and beliefs that may have developed from past experiences. It's a gentle process, it's not rushed, but always focused on their personal growth. The goal is to help the person understand themselves, build resilience, and develop lasting change.
It sounds like a partnership, not just treatment, but teamwork.
Yes, absolutely. Therapy works best when it feels like collaboration and not instruction.
Yes. What are some challenges people often face during therapy?
Sometimes people expect a quick fix, but therapy is a journey, not a one-time solution. Another challenge is facing emotions we've avoided for many years. That can be hard. My role is to make that process safe, supportive, and at a pace that feels right. And yes, in CBT, there is often homework, little exercises between sessions. Some people find that a bit tricky at first, but even small steps can make a big difference.
So, patience and consistency really help.
Exactly. Healing takes time, and that's okay.
Yeah, of course. And could you share an example, anonymously, of how someone benefited from this kind of therapy?
Yeah. I worked with a young man who struggled with anxiety and constant self doubt. He often thought, I'm not good enough or capable, and avoided new opportunities. We used CBT to challenge those thoughts, helping him to take small steps and test his beliefs in the real world. Later, through integrative work, we explored where those beliefs came from, early experiences of criticism and a fear of failure. Gradually, he learned to see himself differently, became more confident, and began enjoying life again. That transformation was beautiful to witness.
Wow, that is so inspiring. Real lasting change through understanding and practice. And before we wrap up, what would you say to someone who's thinking about therapy but feels unsure?
I'd say you don't have to wait for a crisis. Therapy is a safe space to explore what's happening inside you, to learn and to grow. It's normal to feel nervous at first, but reaching out is brave and it's a positive step. You deserve support and understanding, and therapy can offer that.
Beautifully said. Thank you, Bilquees, for sharing your insights and kindness with us today.
Thank you, Emma. It's been a pleasure.
And to our listeners, if you'd like to learn more about CBT or integrative therapy, or book a session with Bilquees, visit oaktreeconnect.co.uk. You'll find all the details there, along with other mental health services we offer. Thank you for joining us today on Oaktree Connect podcast. Take care of your mind, be kind to yourself, and we'll see you next time.